the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. Do caregivers provide infant care? Bringing home your baby is an exhilarating yet overwhelming experience. This is especially true when facing the added complexities of a chronic medical condition. At Best Care, we're dedicated to supporting families through these kinds of circumstances. Respite care is one way we can help families with infants facing complex or chronic medical needs. For many new parents, the discovery that their infant might require ongoing medical treatment can be daunting. Fortunately, advances in home care technologies have greatly expanded the possibilities for infant care at home. Infants who require extensive medical care, such as those needing ventilators or specialized feeding tubes, can now thrive within the comfort and familiarity of their homes. The role of caregivers in providing in-home infant care. Caregivers are more than just support staff. They are a lifeline for many families. They provide essential services that ensure the baby's holistic well-being. This, in turn, gives parents a much-needed break. Here are a few examples of how in-home caregivers support families with infant care. Feeding assistance. Respite caregivers can help with bottle feeding or help manage feeding tubes. Diapering and bathing. Basic hygiene is critically important for infants, especially those with health issues. Caregivers are trained to do this safely, considering any medical conditions. Ensuring safety and comfort. Whether it's adjusting sleep positions, monitoring for signs of distress, or using apnea monitors, caregivers ensure your infant's environment is secure and comforting. Medical questions that might qualify infants for home care services. Many infants can benefit from home care services, particularly those suffering from conditions like congenital heart defects, structural problems with the heart present from birth, which can range from simple issues with no symptoms to complex problems with severe life-threatening symptoms. Bronchopulmonary dysplasia, a chronic lung disease often affecting babies who are born prematurely, particularly those who need long-term mechanical ventilation and oxygen therapy. Neonatal diabetes, a rare form of diabetes that occurs in the first 6 to 12 months of life, differing from type 1 or type 2 diabetes and often requiring insulin treatment. Cystic fibrosis, a genetic disorder affecting the respiratory and digestive systems. Cystic fibrosis leads to severe lung infections and difficulty breaking down and absorbing food. Down syndrome, a genetic disorder caused by an extra chromosome 21, also known as trisomy 21. Babies with Down syndrome may have developmental delays and could be prone to a variety of medical issues, including heart defects and respiratory problems. Gastroesophageal reflux disease, also known as GERD. While reflux is common in babies, GERD is a more severe form that can lead to feeding problems, weight issues, and respiratory complications. Hydrocephalus, an accumulation of cerebrospinal fluid within the brain, which can cause neurobiological problems if not treated, often requiring surgical interventions like shunt placement. Spina bifida, a congenital disability where there is incomplete closing of the backbone and membranes around the spinal cord, often leading to physical and intellectual disabilities. Each of these conditions presents unique challenges, but all of which can be effectively managed in a home setting under the specific direction of professionals. This tailored approach enhances the infant's quality of life. It also integrates care routines into a family's daily life, making management a new normal. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.